it's crazy, but it's
You're watching Channel Z, the world's leading zombie apocalypse channel, broadcasting live from Studio Z.
makes me act the way I do.
Welcome and hello. You are joined us for the very special Dr. Zed show, the October 17th edition, this Friday, part of the zombie apocalypse medicine meeting. As always, I am your host, and I am, as I always am, Dr. Zed, aka Joe Alcock in the before times. Today, I am joined by zombie medicine expert and all-around good guy, Clint Kalan. Today's episode, we will be talking about doing drugs in the apocalypse. Now, when I say doing drugs, I do mean this, doing drugs under physician supervision. I'm not talking about recreational use. We're talking about physician supervision. So there's
Thanks,
that.
Dr. Z.
Yeah. Well, thank you, Clint. Tell us a little bit more about.
In the before times, I worked as a physician assistant. Right now, I'm just a practitioner of garage medicine and surgery. Right now, which is somewhat lucrative and pretty important right now. I mean, I think an important caveat to today's discussion: I'm not a pharmacist. I'm not a PhD, but we're stretching things here in the after times and making use of what we have. Speaking of, Dr. Z, you're looking a little under the weather. Is there anything I need to help you out with, or?
No. You probably are referring to my hat. I don't normally wear a beanie on this show, but I was feeling a little cold. That's why I put on this ascot to warm my neck. I had some shaking chills earlier today, but I have to tell you, Clint, I feel great now. I feel better than I ever have. And Atlanta Rain, thank you. I am okay. I have nothing to complain about. I have no pain. I have no fever. I am feeling well. I feel really like I did maybe 20 years ago. I have that kind of strength. I am hungry though. I do have that. But tell us more, Clint, about our topic for today's episode.
All right, Dr. Z. Anyway, I think I got my last stash of drugs from your place a little while ago, which is probably a good thing. But anyway, I think it's really important to recognize that a lot of what we're going to talk about today, drugs are pretty miraculous in the realm of science. They've taken a tremendous amount of work to help develop, including antibiotics, pain drugs. They often require pretty exacting scientific practices to manufacture and some pretty specialized equipment. So drugs are gold in these days and age. And anything that you hold on to is probably gonna be a really good thing going forward. And I think the first thing we need to talk about, we're going to talk a lot today about kind of what you can do to use your environment to help you in staying healthy or getting well. But really talking about what we had before and how long we can make it last. I don't know. Do you have anything left over in your stash, Dr. Z?
I've got my stash. This is from my own personal go bag. I've collected these kinds of things really for years, many years, as it turns out. I've got naloxone. I've got diphenhydramine. I've got nitroglycerin. I've got alcohol. I've got it all.
Yeah. I mean, but those are all still good, I would assume, right? Like all well within date. I mean, I've forgotten how long it is since. They're probably all still good in your stash, I would imagine. Nothing's too out of date, right?
Well, this nitroglycerin tablet, sublingual, expired in 196. That's fine, isn't it?
Yeah, I mean it probably still tastes sweet.
Expired in 2004, just a short time ago.
That might be getting closer. What else you got?
Cephalexin expired in 2016. It's fresh.
So that actually might still be good as gold. You could probably get a pretty penny for that on whatever street is left.
That's true.
What you got in your hand there?
Oh, this is a sublingual nitroglycerin spray. Now, for heart attacks, we're not really using this stuff so much anymore. I kind of wish I had some aspirin, but all I got is that darned willow tree out front. Oh, I did this naloxone.
Yeah, I mean, you could take it
hydrochloride.
away. And I think some of our audience members are really getting at, kind of the issue is now that it's the post times, can we use our expired medications? And I think most of the time we're talking mainly not about it being kind of dangerous to take medicines that have expired, but is it going to work at all? And I think a lot of what we know about that actually comes from some really apocalyptic sort of stuff, which is what used to be known as the strategic national stockpile. Now it's an empty warehouse somewhere now that everything's been gone. It's basically
we cleared out.
I don't know. I don't know which pandemic actually cleared that strategic national stockpile out before, but I mean, it's generally this gigantic, repository of drugs and ventilators and other equipment that's spread over the country and nobody can really know where it is. And a lot of what they've done as far as looking at expiration of medicines has been to save the government money because, back in the days, they didn't want to spend a bunch of money on medicines that still worked. And since they were the government, they could say, we can just exempt this expiration date and keep using it. And so what they actually did is they looked at all these supplies of medications and they did tests on each of these different kinds of medicines and saw, at the expiration date, which ones were still good. And then they kept testing them kind of throughout the period of time. And as soon as it dropped, below about 90% effective, then they'd take it out. But a lot of these drugs lasted 4 or 5, 6, 7 years before they took them off rotation. Now, most of them didn't make it past a decade, but a lot of them ended up not getting pulled out of that stockpile until 4 or 5 years down the line. And at that point, they're only 90% effective. And so maybe we could still use some of those. I think that Keflex, the cephalexin that you have is probably still really good. I think you could probably get a good amount on the street for that one. I'd tuck it in your pocket, or maybe looking at you, I'd actually take it.
Well, legal is kind of, here's a comment here from Summer Mengel coach. The question is, how do you legally acquire drugs, antibiotics, for example, for the go bag?
I think it depends on exactly what's going on, but a lot of times, especially for expeditionary medicine or travel medicine, if you talk to your doctor or whoever you get your medical care from, they can prescribe you a medication for something, to take overseas or to take, as a precaution or to take with you. Now you just have to find a pretty zombie-minded doctor to go to really get that, extra oomph.
Right. Oh, a question for me from Ilana. Dr. Zed, would it be legal for me, Dr. Zed, to prescribe meds to my friends for their go bag? Yes, we do this all the time for our travel medicine, expedition medicine kind of events. If we're going to go up to, Chimborazo in Ecuador or head off to Everest and we need some high altitude medicine, then I'm going to prescribe some dexamethasone, which I hear is a very, very good drug, along with some other things to prevent maybe some acetazolamide. So I'll prescribe medications for my friends for special use, and I've done that before. That's perfectly legal. Now that the pharmacies are closed, again, we're talking about before times here, but that is a legal activity. Yeah.
Yeah. And have you ever been on one of those, things and had somebody have something really bad where they needed to be, you wanted to relieve their pain, or maybe, God forbid in these times, you have to do an amputation. That's a little brutal right now. I think a lot of people would pay a pretty dollar to not have to be awake while all that's going on.
Right. I mean, you I'm sure remember, we used to, back in the before times, one of our favorite drugs was ketamine. By favorite, I mean we used to prescribe it a lot because it has a great safety profile. It's relatively less dangerous than many other things that we could use to sedate people for painful procedures.
Yeah, it's like great. It does make people feel a little bit funny and sometimes see a little bit funny things when they go through that.
Sure.
But I ran out like a year and a half ago. And so, there's a few things that I can still find around to really knock people out. And it's kind of going back to the good old days. Have you ever
used your libation there?
This is a Bosque Brewing Company Scotia. So
yes.
I think it's aged in Scotch barrels. It's great.
I do remember that from the before times. I haven't seen a can of that in really, it's been many months.
Well, I've been hoarding it here in my garage. But
maybe you shouldn't admit that on this public forum.
well, if you knew where my garage was, Dr. Z.
Okay, good point.
Anyway, I think in the before times, it actually, if you think way back to Civil War times or the time before we had real anesthetics, and really even in the 1960s and 70s, they were experimenting using alcohol as an anesthetic to put people to sleep for painful procedures.
And alcohol never goes bad.
No,
Right?
I mean,
it just gets better with time.
It depends on how long you let it ferment and what the concentration is. But I think what we're talking about here is very, very, very distilled medical grade alcohol. But I'm sure in a pinch you could make it work somewhere else. Have you ever done, when you were a doctor in the ER, did you ever give anyone alcohol?
Believe it or not, I used to do this long enough that I recall in the burn unit we had, and in the intensive care unit, we had a refrigerator that contained alcohol. We could just to give as a beverage for patients. And then again, if we had someone who with a ethylene glycol overdose, there are situations, or methanol overdose, where we could give IV ethanol. So that is a thing. I've done that in my career. No joke. It's it's hard to sometimes take me seriously in these after times, but I'm actually being serious here.
The Ventolin doesn't. Yeah,
asthma. What do we do? So you mentioned that a lot of things. In fact, most of the things they look for in the strategic national stockpile, in fact, seem perfectly good well after their expiration date. But albuterol may be, or salmeterol may be a exception. Tell us about that.
Yeah, it was one of those things that at the expiration date for a lot of the albuterol inhalers, they found was there was less than half was actually effective past the expiration date. So I don't know. It's activates some of the chemoreceptors in your body called beta receptors. There's other things that you can try for that. Epinephrine. I've never cut out anybody's adrenal glands. Ground them up before, but Dr. Z,
that's sounding surprisingly tasty.
Sorry. Okay. But yeah, I think in your situation, finding access to anything else that would be useful and avoiding triggers are probably pretty important things. But if you really get into a pinch, there was a guy who was actually the chair of anesthetics in Northern Ireland in 1969 who published a paper on. It was in Ireland on anesthetizing people. Yeah, it works surprisingly well. The main downside is that some people, even taking out the people who drink heavily or use other substances, have a very wide range of susceptibility to being rendered unconscious by alcohol just by their genetics. But they found, people had actually been studying it a while, that 2 to 3 cc's per kilogram of pure 100% ethanol had, delivered over 15 to 20 minutes, reliably knocked most people out.
We're talking about giving it intravenously, right?
Yeah, you need at least a needle, and some tubing is helpful, but you could probably jerry-rig it if you really had to.
All right,
Dr. Dundee actually found that if you gave it a little bit faster, if you gave it over 4 to 5 minutes, you could cut your dose down to about 1 mil per kilogram of pure alcohol. And so,
so for a 70 kilogram male such as myself, that would be actually I weigh a bit more than that these days. Although, gosh, I'm hungry. I am hungry. We're talking
you don't
about
look like you weigh as much anymore, Dr. Z, but
help me out here. How much?
Yeah, it's about 70 milliliters.
Right.
So a couple shots worth. Granted, that was 100% alcohol.
My math skills seem to be escaping me now for some reason. My
diabetics.
Right.
I know I actually hadn't looked at that, but I know you and Amanda Gallagher had talked a little bit about potential options for that in the past. Can you tell us a little bit more about the pancreas, Dr. Z?
Beta islet cells in the pancreas are responsible for secreting insulin. The problem with type 1 Type 1 diabetes is the autoimmune destruction of these beta 1 cells. There's another kind of diabetes, type 2, in which your body is essentially resistant to the effect of your own body's insulin made by the pancreas. So that's what I can tell you. In diabetes, it's the problem of not enough insulin and not enough insulin action.
Yeah. And so, I mean, I don't think anybody in the before times had gone through and ground up a bunch of pancreas and tried to eat it or go along those routes, but that might be your only salvation, which is kind of unfortunate going forward.
But really, it is tricky. Type 2 diabetes can oftentimes be treated with weight loss. And again, many of us are experiencing weight loss involuntarily these days in the after times because of the lack of calories.
Yeah, you know.
Oh yeah, back to our beta agonist, or Ventolin for asthma, we decided that probably most of the stocks that you can find that haven't been manufactured in months to years, they may indeed be expired.
It's kind of turning into a grim show, Dr. Z.
Yeah. Well, you know, I don't want our asthmatic listeners to be too distressed. Again, they might use other things like a long-lasting inhaled steroid, perhaps. They may have similar problems. I imagine that, again, pill form steroids may be helpful if you're in a pinch, but those have all kinds of side effects. All kinds.
It would get you through, though.
It would. Aquaculture,
like metronidazole. So metronidazole is actually, got to get that in focus. Is a pretty good antibiotic for bugs that don't like air, and sort of, you know, genitourinary bugs. Skin and soft tissue infections, which is probably what we're going to be dealing with a lot of. It doesn't work great unless you know, we're running through the swamp. And so it's, I mean, the other thing about the after times is probably our antibiotic resistance is going to drop very, very low. And so most things might be pretty effective as time goes on. What do you think, Dr. Z, about preventing skin and soft tissue infections? I mean, it looks like you got a little scratch. Dr. Z?
Shaving cut. You know, just a little aggressive shaving this morning. That's all that is. Yeah.
Is there anything I can? Yeah. Oh, you look. Yeah. Well, I am willing to at least leave this out for you somewhere. I don't know if I want to bring it to you, but this is honey. And honey is actually a really fantastic kind of antibacterial, antiviral. That's plastic, isn't it?
It's wood. It's just a pencil. Okay. I'm sure you chewed on pencils when you were a child.
But anyway, you know, honey.
I do have a temptation to chew on things that are maybe not considered traditional foods.
Yeah, that's like pica. There's actually a word for that, which is pica.
Pica.
And a lot of people, you know, it can actually be something that is pretty common in some cultures, and in people with severe iron deprivation, they can actually, it will lead them to eat clay and eat dirt and kind of eat other things going forward.
Right.
So it's
according to the Aftertimes Wikipedia, psychological disorder known as appetite for things that are non-nutritive, such as ice, hair, paper, or could just be unusual items, foods that we don't think of as being typical foods.
Yeah. But getting back to the honey, Dr. Z, which I think I'm going to keep for myself now. It works great. It actually, there's not great evidence that it works as an antiviral, but as an antibacterial, it actually shows some pretty good evidence. There's actually a pretty solid, in the before times, kind of scientific collaborative called the Cochrane Review, which kind of published the best of review articles about things. They kind of were the gold standard in the before times. And they said the evidence wasn't great, but there's definitely some evidence in folks that had medium severity burns and in infected postoperative wounds that honey would heal them in about 2/3 the time of just standard antiseptics and bandages. They think that's maybe a little bit of the immune inducing power of, you know, kind of the activation of immune generating particles. It's a very sweet medium. And it also has actually hydrogen peroxide in it, kind of in the way, you know, you just don't want to pour hydrogen peroxide in your wound because that'll actually kind of kill any of the living tissue that's right there. But the small amounts there, actually, they thought was a pretty useful thing going forward. So that's not the only thing going forward. Have you found that you're more sensitive to sound right now?
You know, again, I feel very alive. I feel very
Have you found
tuned.
that your hearing is better?
It might be. There are certainly some sounds irritate me more than they used to, and I get angry. But so there's that.
Okay.
But you know what I love about this? This is like a journal club in the before times. We're talking about these Cochrane Review articles, the meta-analysis, the systematic reviews, putting together all this data so that we can understand at a real importance level the evidence for or against things like honey. Yeah. But yeah, I'm convinced. I think that honey, if I had a burn, I would certainly use one.
I mean, it depends on how bad your wound looks, Athena. I think the main thing in your house is keeping things sterile and dry, or not dry, but actually most wounds do better in a little bit of a moist environment, because you can kind of break down some of the gunk that builds up over your scratches. But it doesn't have to be like Neosporin. It can just be any kind of, not clearly infected moisturizer. So Vaseline actually works pretty well over the top of wounds. And your body actually for a long, long time was really good at walling off infection, which is how we survived for a long, long time before, basically the start of World War II, when we really had broad access to antibiotics.
I'm a big fan of harnessing the evolved host defenses that we have as part of our natural immunity towards wounds and that sort of thing. Fever is good. I may have had a fever earlier today. I think it's gone now.
I bet. I would argue that
we should not treat fever during any sort of apocalypse or pandemic. I'm on record saying that. We've had talks about immunity. I think that harnessing our body's immunity is a good thing. When that falls short, though, this Cochrane Review provides great evidence that some of the antibacterial or bacteriostatic effects that actually inhibit the growth and the proliferation of bacteria in the wound, as well as its immune effects, have some real benefits to you.
And really, if you get a wound, washing it out, it doesn't have to be saline. It doesn't have to be some special, kind of solution. As long as it's clean water, there's a pretty clear correlation between how much clean water you put through a wound and a decreasing chance of infection. And so oftentimes, even in the old times in the emergency department, if somebody had a bad cut, I'd turn on the faucet as high as it would go and just put their wound underneath it. And if you flush it out with a little bit more time, it's basically a function of how much water you can put through that wound at a medium amount of pressure will help really kind of reduce the chances of infection there, and then keeping it covered. But what about
pain control?
What about
no?
Yeah, I think pain control, we've lost a lot in the black market. I mean, most of those have kind of gotten sold off. But some of the riparian areas kind of hold some area, we talk about coming back to the beginning again, kind of before the before times. People have looked, have really chewed on willow bark.
Willow bark as opposed to a pencil. If I'm going to chew on anything, you recommend willow bark. This came up earlier during a workshop that I had with Danielle Cybulski. We talked about, a small abrasion. This hardly even counts, really, Neil. I wouldn't even comment on this, really. But you're right. Willow bark has been used for hundreds of years as an analgesic. Is there any evidence, Clint, for the use of willow bark that we can rely on as opposed to just, folklore?
Yeah, actually, granted, it's salicin is the active ingredient, usually in kind of the spongy inner part of the willow bark, and that's related to acetylsalicylic acid, which is aspirin. And so a lot of the data that we have on this are of people actually extracting the salicin from the willow bark, and usually that's done just in a cold water bath. There's some ways of making it a little better, but you're chewing on it and putting it in a medium area in your mouth is probably pretty effective. And there's some studies that show for low back pain that people had a better response than placebo and a non-inferior response to some of the things that we've looked at, like the NSAIDs, the non-steroidal anti-inflammatory drugs that we take on a regular basis.
Okay, so at least these were controlled trials. That was my next question: was did they have an adequate control? And you're saying that they compared them against something else, like
it was an NSAID that I do not use very often, but it looked enough like an NSAID on my review.
Right. That's right. Ricoxicibicin, something like that. That's not it.
Another COX inhibitor.
It was a COX inhibitor. That's correct. And again, this is serious stuff. The paper is effectiveness of willow bark for musculoskeletal pain. They looked at a willow bark extract for low back pain, compared it to not placebo, but an alternative pain reliever. And they included 7 randomized controlled trials, or at least controlled trials for this. So good stuff with decent high internal validity, some inconsistencies in some of the studies, but at least there is some evidence to suggest that using willow bark extract is effective for back pain. One point though, when they've looked at a lot of things for back pain, they've looked at crystal therapy, they've looked at breathing exercises, massage oils, aromatherapy. Virtually everything works for back pain if you actually go into the literature.
And back pain almost always lasts weeks and gets better slowly. But most of it gets better no matter what.
Yeah. So I just want to make sure that our audience is aware of that. Yeah. Looks like we've got 4 minutes. Are there any topics that we've not covered? And I do want to remind the audience that we are open for really any question on any topic whatsoever. Aha, vitamins. Great question. So a lot of Rain asks, if you had to pack only 1 or 2 vitamins, what would they be?
I'm going with vitamin. Well, it depends on what the sky looks like, but I'm going with a little bit of vitamin D myself, because I anticipate that I will probably be spending a lot of time hiding indoors away from the sun. Now, granted, I also have a Northern European ancestry, and I don't need that much sun to get my vitamin D. But if you people generally with less melanin in their skin tend to sunlight, and actually your skin is pretty important in vitamin D synthesis. And the lighter your skin is, the better you happen to make that. And that's why a lot of people with a lot of melanin in their skin often, especially if they're living in a place without a lot of sunlight, can need vitamin D supplementation going on. So that's one of my choices. Do you have one, Dr. Z?
I saw, I believe it was Dr. Cameron on the Go Bag Challenge, maybe yesterday, with Emily Zarka. He made a delightful drink using an emergency packet and some sort of alcohol, which looked pretty delicious, I must say. So I might go for that. Scurvy. With scurvy, you can get skin problems, non-healing wounds. So it's very important to make sure you have a source of vitamin C. I guess I'd make a plug for that. But again, most vitamins really are unnecessary as long as you have, a well-rounded diet. A diet that contains all the nutrients that you need. I have to kind of go back to a previous. I'm just thinking about one of our previous episodes, and that meal that we had. What a delicious meal! Again, if you remember, this is Clint. You were part of this, weren't you? I thought you had some of this too.
I thought Amanda had made us Jell-O brains.
I thought mine had a delightful peach flavor. And again, as you know, I ate enough of it. This is sort of the post picture. I had a lot of that brain, a few days ago. So all this discussion about even vitamin C is making me think about eating some more of those delicious brains. Well,
Dr. Z, you just have to do you, I think, more than anything else. And really, your diet is kind of up to your own discretion right now.
We call that personalized medicine. I do regret the fact that I did feed a small amount of my brain for dinner to my dog, and I haven't seen my dog recently, so I'm a bit worried. I have to say. Anyway, I think that this is all the time we have for this episode. A very delightful episode of the Dr.
Absolutely
Show, where we went over the effectiveness of drugs that are expired, whether willow bark is something which is useful, and using alcohol for anesthesia. So thank you so much, Clint, for taking us through those episodes. And I would recommend that everybody in the audience do stay tuned for the next show on Channel Z, and that is, again, Emily Zarka's Go Bag Challenge.
And I think we were supposed to also say, there is a no-brainer quiz that might be apropos.
I'm going. I'll be there.
To bring a frosty beverage if you can. Dr. Z, I hope we get to do this again.
Right. Yep. Well, for now, signing off. We'll see you next time.
I know it's crazy, but it seems so logical. I can't deny that there is something supernatural with you. Makes me act the way